Hi there, my name is Dr. Cary Yurkiw. I'm a chiropractor here in Kelowna, British Columbia, and today we're talking about slip discs and how they can cause neck pain. Discs are something that is very common in the clinic. People come in with disc issues in their neck all the time. It could be from an injury like a car accident, whiplash. It could be from something like poor posture. It could be from repetitive types of strain. So it is something that we see quite frequently. And I did write about it in my book called Neck Pain that is on Amazon, Kindle, and Audible. So I did write about it, and I'm going to read some of that chapter 10 on discs to you today. But before I do that, I'm just going to switch to my slides here, and we're going to talk about what a slip disc is and how we can help. So what is a slip disc? I think it's important to know that discs don't actually slip, but it's a very common term that people use when they talk about neck pain from discs. They kind of use it like a hockey puck that might slip in between bones, in and out between bones. But discs aren't that structured where they slip in and out like an ice cube. It's more like a jelly donut where the dough part is attached to the bones above and below. And what can happen is that the ligament can start to try and pull away from the bone and cause some tearing of that dough that's in between the bones. So that liquid in the middle, that jelly part, can start to leak out into the dough part. So we want to make sure that we deal with any slip discs or any issues that way. And how can we help? Well, when people come to see us in the clinic, one of the things that we want to do is a history and then an assessment. So do an assessment so that it can help to recondition that area, find out what the history is behind it, what we can do to help, and then start work to get the ranges of motion restored and reduce the pain in that area. So we want to get that jelly donut functioning properly again. And then we want to give our patients some stretches and exercises to do to help themselves because that can really help the process in the clinic of how to get the disc rehabilitated. So how to reestablish proper function of that disc, stop the pressure on the nerve, and to help people feel better. I'm going to read from my book now called Neck Pain. It's on Amazon, and it was published 3 years ago. And I'm going to talk about discs today, which is chapter 10 in the book. So I'm just going to switch over here back to my original camera and talk about this with you. So chapter 10, discs. The discs in the spine are like jelly donuts. They have a tough outer layer and a fluid-filled center, and the outer fibers of the disc are ligamentous and attached strongly into the bones above and below via Sharpie's fibers. That's the technical word for that ligament that's attached into the bone. There are no discs between the skull and the first vertebrae, nor between the first two vertebrae in the spine. Discs work as shock absorbers. They cushion the impact of physical strain and compression on the body. So they're kind of resisting gravity, maintaining the spaces between the bones to allow the nerve flow to get through. Discs do not slip, as some people believe. They're not like hockey pucks that slip in between bones. They're well anchored and attached to the bones. They can, however, bulge to one side when squished unevenly. If a person has a misalignment in the spine, that can cause a disc to bulge. It would be like taking your hands and pressing on a jelly donut unevenly. The disc would bulge on one side, and especially when the patient bends, twists, and does activity. That fluid-filled pocket in the center can shift over to one side, causing that disc to put pressure on the nerve. The problem with the above scenario is the space between the bones are only so high. And if the disc becomes irregular, then the material starts to compress the nerve coming out of the spine. There's one nerve on the left side, one on the right side at each level in the neck area. This can pinch or trap the nerve and cause pain or disability. My goal is to catch a disc bulge as soon as possible. I then want to realign the segments above and below the disc so the disc material is more concentric, back to the way it should be, in the middle. And the shape of the disc is restored. Traction can be effective in pulling the bones gently apart to suck the fluid back into the center of the disc. Also, rest and hydration are important because discs increase in volume when you're at rest. So when you're sleeping, the disc volume actually increases. Some publications say up to 1/3 of the height during the night. So you definitely want to get the proper amount of rest, have the right pillow, mattress, and get the right amount of hydration so that it'll increase the disc size during the night, giving you more space. So if you have any questions, please type them in the chat. I'd be happy to answer those questions for you. Otherwise, please join me on Friday when I'll be talking about neck pain again. I'll be reading from various chapters in the book, but I'll also be talking about what to expect in the second edition of the book coming up in 2023. Definitely want to add some stretches for specific conditions to the book, as well as some illustrations to make it easier for the reader to help themselves if